See, heart disease doesn't cause overnight. It is not because you have taken a burger last week or you missed a jog for a day. Those are what we eat and those are what we consume in India causes heart attack, then it's going to be a big havoc. And the truth is, it's not just about eating oil, but it is also the quality of oil and the how frequently are you consuming. Hi everyone, myself Dr. Babu, Senior Interventional Cardiologist. Today we are going to talk about heart health. What causes heart disease? Let's break into it. See, heart disease doesn't cause overnight. It is not because you have taken a burger last week or you missed a jog for a day. It usually happens by us ignoring few of the risk factors that we routinely have with us. Okay, Inter-Heart study. This is a larger study comprising 52 countries. India was also part of the study, and which definitive risk factors have been reasoned out, which constitute for 90% risk for heart disease and stroke. These are 1. Abnormal lipids in blood, high blood pressure, diabetes, sugar, obesity, active smoking, and eating habits, not consuming healthier food, and physical activity also contributes to heart diseases. And last not the least, psychosocial factors, that is stress that usually happen we go through day in and day out. Plus, eating oily food cause heart attack. For example, the samosas what we eat and those are what we consume in India causes heart attack, then it's going to be a big havoc. And the truth is, it's not just about eating oil, but it is also the quality of oil and the how frequently are you consuming. Especially the trans fats which we consume in our daily snacks are the real culprit. Studies have shown refined oil and trans fats to be the major culprits in causing cardiovascular disease. And Inter-Heart study which states that switching over to vegetable oils like olive oil or groundnut oil will mitigate or reduce the risk for heart attacks. How much physical activity is really required to prevent risk factors for heart attack? Does it really mean that we have to run marathons? Should we go for hours of gym? Not really. Studies have shown a regular moderate physical activity like jogging, walking, dancing, or even yoga for 30 minutes in a day, on most of the times 5 days in a week, would reduce the risk of heart attacks by around 30%. Here, Inter-Heart study showed a regular physical activity could reduce at least the risk for heart attacks by around 15%. Can heart attack affect young people? It's not just that heart attacks occur in older population. The truth is, a younger population, even at 30 to 40 years, are at risk for heart disease. A study from AIMS Delhi which showed there are up to 30% incidence of heart attacks in people in less than 40 years of age in present day. The heart attacks, why do they happen in young? But most commonly, the risk factors would be stress, abnormal diet, and lack of physical activity, and not to say smoking being the most commonest risk factors. Is heart disease hereditary? Yes, genetics play a major role. That doesn't mean everyone are destined to have a heart disease. Studies, an Inter-Heart study has shown good lifestyle with good physical activity and diet can mitigate or lower the risk for heart diseases. So we should focus on good lifestyle in terms of reduced stress, physical activity, and good diet. Smoking and heart disease. Smoking is hands down, it is definitely the worst thing that can happen to your heart. Smoking actually doubles the risk for heart attacks and stroke, and studies have shown even passive smoking is a risk for heart attacks and stroke. How does diabetes increase risk for heart disease? Think about blood vessels as plumbing, and diabetes tends to cause wear and tear in these blood vessels, can make the heart harder for it to pump through these vessels and causing clots, heart attack. India is having one of the highest number of diabetes, about 77 million in the world, and having diabetes increases the risk for heart attack by around 4 times. The best way is to control sugars at a very early stage so that the complications of heart disease, heart attacks can be prevented. How can you protect your? The good thing is power is in your hand to take care of your heart. Take actions. Have a regular balanced diet, regularly exercise, and quit smoking. Reduce stress in your lifestyle.